Welcome to the Strive Through Falls Five. Wow, I can't talk today. The Strive Through Five Small Business Podcast. My name is Irvans Agustin, and this podcast we talk to the owners, builders, organizations, and decision makers that really not just help shape our economy, but also are the backbone for our ecosystem that we call home. And one thing we try to do on the show is go deeper, like I was saying earlier, and go beyond the headlines, go beyond some of the success stories and highlights that many times we often do. And mostly because behind each organization, behind each headline in the story are people. And every neighborhood, every company, every movement, there are those individuals that carry the pressure, and they carry the responsibility, and also pushing to build opportunity, and all at the same time while dealing with stress or burnout or caregiving or anxiety or just real life issues that come with running a small business or an organization. And I, like I was telling you earlier, honestly, I feel it's a conversation that I, as a small business owner, don't hear very often. And I don't think collectively, I don't really see it highlighted in any in any real aspect. And also, as I was mentioning earlier, it's often spoken about in a silo or in a bubble, and not necessarily attached to real people and real individuals and real stories. And that's part of why I'm excited to talk with you today. And that's I think today's conversation is an important one. And aside from the fact that we had a little delays in getting here and we figured it out, and all the human challenges that come with it, and I think it kind of really helps embody all the struggles that all of us deal with one way or another. And in the end, we figure it out.
Right.
And because we spend a lot of time talking about economic development here in Miami, and small businesses or businesses in general, and bringing business here, we talk about growth, we talk about investment, we talk about new businesses and innovation and population growth, but we don't spend enough time talking about the emotional infrastructure that kind of holds all these things together. What happens when an entrepreneur burns out or gets overwhelmed? What happens when people feel isolated or struggle on their own trying to figure out things, whether you're running a big business or more intentionally a small business as well, and everything that comes with it, whether it be families, whether it be an organization, and you as a solopreneur trying to keep it all afloat. Mental health affects workforce participation, it affects parenting, it affects leadership, and it also many times affects small business actual survival. And it's still one of those conversations a lot of us collectively avoid. And today's guest has spent several years, is that fair to say? So a few years?
In this particular role?
Well, just in general, like operating directly in this reality, because I think there's definitely, in this particular role that you're in now, but as a person who owned a business before, you had a different aspect from and dealt with it from a different standpoint. But I think it's a tie that binds all the way to now, if that's fair to say.
Absolutely.
And our guest is Susan Holtzman. Did I say that correctly?
O'Mahony.
O'Mahony
Holtzman.
O'Mahony Holtzman. And she's the president and CEO of NAMI, N-A-M-I, Miami-Dade County, one of the leading mental health advocacy, education, and support organizations serving Miami-Dade County and the Florida Keys. Do you guys go all the way down to the Keys too?
We do. We cover Dade and Monroe County.
Wow, okay. What makes her story especially interesting is that her background spans entrepreneurship. She ran a business, a very unique one, healthcare systems, public policy, and nonprofit leadership. Did I miss anything?
I don't think so.
She previously worked for the Office of Mayor Daniela Levine Cava, leading work around mental health, disabilities, and older adults. And she also led health systems work for the Alzheimer's Association, and previously founded and successfully grew a national medical education management company. Did I categorize that right?
Yep.
And perhaps more importantly, she also has a person who has lived experience and dealt and handled many of these things herself. So this conversation, again, for me, me personally as a small business owner and who have been friends and others who have dealt with different issues or complications, health or mental health related. That's why I was saying to you, like for me, it's also personal. I think it's a unique and interesting conversation. That's why I'm happy you made it here today and happy to have this conversation. And all that said, Susan, welcome to the podcast.
Well, thank you so much. It's really a pleasure to be here. And we did have a little mix up, so we got off to a late start, but I appreciate your...
People online will never know.
That's right. People online will never know that what happened before. But we're here and I'm very excited to be speaking with you.
So starting from the beginning, you were telling me off camera before, you started in entrepreneurship. You had your own business before. What originally pulled you into running a business?
It's funny because I never saw myself that way until I was there. But I was working for Baptist Health System, which right at the point, so people who are from here are going to know this was a while back, right at the point when it was moving from a hospital to a health system.
Yes.
And I was working there and I had two small children who were in the daycare center there, and it didn't feel right to me. I had to work long hours. My children were in daycare, and I felt like I had kind of lost control of my own narrative there. So I thought there's got to be a different way this can work. So one of my main roles there was to run some medical education conferences for the Baptist Cardiac and Vascular Institute. And I had been doing that prior. I worked for a medical association in Washington, D.C. before I moved to Miami. So I had experience running conferences. So I decided, and it's great to be on your show because I'm talking to my people. I decided I needed to find a different job. But then when I started to put a resume together and thought, now I've got to sit down and let people tell me whether or not. Yeah. I wasn't up for it.
Yeah.
I was like, wait a minute.
This is not the conversation I want to have.
No, it wasn't.
Especially once you've had a couple of jobs before and you know what it entails and you're at a different stage and point in your career of just like having some sense of self-awareness as an individual and a person to make that decision does come with experience. And I'll commend you for taking that step because it can be scary as well.
Yes. And I made a deal with my husband at the time, and I said, give me a year, and if I'm not making what I'm making now, I'll go get a job. But give me a year to try my own business. And so I wanted control. I wanted more flexibility so that my children weren't in daycare for as long as they were in, and it worked. And I was able to get a couple of different contracts for medical education conferences. I was working in a field of medicine that was kind of really growing at the time. So doctors needed to learn these new techniques. So that fueled my growth. There was a need for what I was offering.
And also it's very specific set of skills.
Right.
So you can't get the average YouTuber to come do this. So I think that was also an interesting, timing is everything many times as part of it. So that's really interesting that you structured it and worked out for you. And fast forwarding a little bit, in your subsequent roles after, what are some of the lessons that you learned from owning and running your own small business that you've applied to some of the work that
I do now?
Yeah.
Okay. Well, there's so much. I think, to me, my career has been just constant building. So when I worked at Baptist, they put the management through a lot of management training, which was great to have when I was running my own business and building my own team, because I had that to rely on. I had a structure in my mind that I can, because you don't have money really.
Yeah, you don't. And as a person who did not have those management things, you learn a lot of things the hard way. So I think that's hugely important, like those lessons that sometimes just basic things and just organization that go a long way to just saving you time and effort and, as a business. So like now those lessons like still serve you to this day.
Absolutely, they do. And so I think, for me, so I went from that. I eventually sold the company and I took some time off. I had a non-compete and all that kind of stuff. That's a whole nother show, I think. But during that time, I got my graduate degree in gerontology, and that's when I started going the other direction because I was looking at this older population that we have that is ballooning with the baby boomers, which is me. And I thought, you know what? There's going to be innovation here. There's going to be changes in medical needs. This is a place for an entrepreneur to go. That was my original thinking. That's not how I ended up. But I did, I worked for the Alzheimer's Association after I got my degree, which taught me a lot about how nonprofits work. And I had been a volunteer advisor to Commissioner Levine Cava. I was her volunteer advisor on aging population issues, and I did that to get to understand that landscape better, to get to know the market.
Yeah,
is what I was trying to do. When she got elected, she asked me to join her staff as her older adult advocate was the title at the time. And then she added on disability and mental health. So now I was dealing with 3 truly underserved communities of people.
It's a very long acronym.
Yeah. We won't even. So in that role, and we talked a little bit earlier about this, an entrepreneur in government, that's tough. That was hard.
Yes.
Because we move fast.
Yes.
Right. Entrepreneurs move fast. We make decisions.
We don't run at the speed of business.
No, yeah.
And so you definitely had to shift gears when you stepped into that different machine.
Right. Very different machine.
And you weren't driving.
Right. And you're never driving, and the market forces are different. It's a really, what drives a lot of decision making in government is very different from regular market, right? Yeah. So that was a big learning experience. But when I was in that role, I was asked to be on the board of NAMI, which stands for National Alliance on Mental Illness. And it was interesting because I was like, I don't have a background in this. Mm-hmm. I don't have a background in mental illness. I'm not trained in this. But what I learned was NAMI's focus is your lived experience is what has value. And I have a lot of lived experience in dealing with mental illness in my family. So, okay, one of these things that I learned had value that I didn't realize had value. Yeah, so
100%.
Which is so important in business.
No, it totally is in so many different aspects. The people who are providing the care have a unique set of experiences that the practitioners don't. You visit the doctor and you see him for X amount of time, but it's the caretakers and the caregivers at home, and like even my own self personally, like when my parents were aging, my sister was the one who really said, I'm going to move back home and live. And there was support that she needed. Right. And we don't always think about that collectively as a society of the person like, oh, you just got to stay home and take care and that's it. No, it's work. It's work. And there's a lot of emotional aspects that come with it. And there's not a lot of resources or tools many times that people can rely on or know that are available. And it's important work, but many times it's not categorized as work, and it's just kind of like, it's just something you do. Right, and there are starting to be payment for home caregivers and things that. Yeah, or tax breaks if you're a home caregiver. There's some things like that happening, but in general, it's not really compensated, and it's not the thing about it. Too is it becomes technical when you're caring for an older adult and trying to navigate
the healthcare system or the care system, whether it's assisted living or nursing homes, or getting help to come into your house, or figuring out prescription medications.
Yeah.
There's a whole, that's a whole field.
A whole vocabulary that my sister has that I didn't learn, but she knows all the medications.
Right. And you have
and
to
how
learn
their effects
it.
are, and you know, she had her own little minor in health medicine that she learned just the hard way of studying and researching just to make sure things are applied the right way. And whether you're dealing with an adult or a sick child or in between, there's a whole set of just work that comes in education and learning that you have to do to be able to provide care for this person that you care about.
There's a language to it. And so the same in mental health care.
Yeah.
Because that's a whole nother field. And if you or someone you care about has a mental health condition, you have to learn to navigate that field and that field of medicine, and how do you get help, and where do you get help, and how do you pay for help, and all of that. So that's a whole nother ecosystem. It really is. So when NAMI was looking for, I was on the board and we were looking for a new CEO, and I was recruited. And I think going back to the original question, how did my business skills, so not-for-profits are different than for-profit companies in that you're not supposed to make a profit. All the money goes back into the organization. And it's regulated. But what I brought to the table, besides my mental health experience, was my business
acumen.
I started running it like a business, which in a lot of not-for-profits, they start with volunteers who don't have a business background. And so there are basic business practices, like best practices, that aren't being followed.
Yeah.
And they're so important. And that was one of the things that I really felt my company was successful because we had this infrastructure.
Yeah, that foundation.
Right, of good practices.
Yeah.
And so
that's a unique set of experiences and tools that many times, exactly what you said, nonprofits don't necessarily run as a business. But I think that becomes so much more critical when you fast forward to times like now, where funds aren't just as easily or readily available. Not that they're easy to get all the time, but like now it's
harder now. For sure.
It's exponentially harder now.
Yes.
And then so if you're not designed to be able to show the returns or to run as a business, or how do you start running as a lean startup and shifting gears of like, we're working with far less and we still need to accomplish 10 times more. How do we do that? And so like that business acumen really comes in handy. If not just handy, critical, it sounds like.
Absolutely. I think so. There's a couple of other places that it really has made impact. One of the issues that you see a lot in not-for-profits is what they call mission creep.
Yes.
Right? So, and that was my mantra within my organization.
You can't do everything for everybody.
Right. Is that within our mission? And there was a lot of ways that we were, like I told you, the work we did had a lot of production. And so we would sometimes creep towards becoming a production company. But I'd have to say, no, we're an education company. We're not going to invest in all this equipment. We're going to rent it because that's not what we do.
Right.
And
because once I do rent it and buy it, or if I do buy it, then I got to store it and I got to take care of it and everything else that comes with it. And so it's like, no, like, stay in our lane.
That's a whole nother thing. And I think for a business to succeed, it's really important to do that.
Definitely a fine balance.
Yeah. I mean, when you're ready,
right. If it makes sense. Yeah.
But it wasn't, I never felt that we were ready in that direction. And so that mission creep is something that we really, because with not-for-profits, you might have an opportunity for some funding to do something that is like sort of mission adjacent, and you want the funding. So you're like, maybe we should just do it.
I'll just do it.
Yeah, but then it detracts from your true mission, and then when that grant runs out, which is what happens,
Yeah. Or
It's
even
like,
when it doesn't, like if
yeah,
you do get the grant, now you have a whole set of reporting, you have a whole set of deliverables and other things.
exactly.
And I think it's like many times the same thing applies to small businesses, like you were saying, where you just, well, I'm close enough to this. I'll
Hmm.
just do this just to be able to bring this stream of revenue in. But then there's 14 other things that I need to support this.
Right.
And we don't always think about that. And I think it's exactly true for what you're saying many times at the nonprofit level,
Yeah.
where you try to do. And the thing is, like you're trying to do good work,
Hmm.
but you still can't be all things to everybody, and that's where
Right.
the hard choices and hard decisions come up.
Yeah. And I think, well, the other thing I think that that I learned in business, and this was just, people have different styles, but for me, when I was talking to a potential client, it was very much about listening to them. What are your needs? What are you trying to accomplish with this? Like for a medical conference, if people would come to me and say, we want to have this giant conference. They all thought they were going to have the giant
Yeah,
conference.
everyone thinks it's going to look a particular way.
Right. And so, I'd say to them, what is it you're trying to accomplish? Are you trying to educate 100 doctors in a new procedure, or are you trying to raise awareness about that your hospital is now offering these services? Let's talk about what you're really trying to accomplish and then how we can do that. And I think, when we work with, like we're going to talk in a little bit about, we have our walk coming up, and when we're looking at sponsorships, there's sort of a philosophy in not-for-profit is you make an appeal to their heart. You appeal to people's heart, and that's how you're going to get funding. But with my background in business, I'm always like, well, what are you trying to accomplish?
Yeah.
And how can we make that happen for you and work for us too? Where's the synergy there? And I think it's a little different approach.
No, I totally agree with you. And even in other things, like even some of the commercials, like people try so hard to appeal to your heart.
Mm-hmm.
And even just as a consumer watching, the commercials work up to a certain point. There's
Right.
only so many times because they show a small baby, flies, dirty, and sick and dying, or a puppy, and they do that. But after a certain amount of time, that wears off.
Right.
Because then it just becomes uncomfortable, and you change the channel. So the effect that they're trying to have of appealing to your heart runs out.
Right.
And then what? And I think it's exactly what you're pointing out. Like, how do you balance appealing to people's heart, but then still being realistic and focusing on the return on the investment that they're doing and the impact that you're having collectively.
Right.
And I think it's just overall, whether you're running a small business or whether you're running a nonprofit or at a municipal level, how you balance that, still appeal to what people want, and how do you? And I guess that's the question I'm trying to get to, is like, how do you do that? For you on your end, how did you find the best work to create that balance?
Well, I think for us at NAMI, the way I start is talking about, 1 in 4 people lives with a mental health condition.
Wow, 1 in 4.
1 in 4.
Nationally, or just here in Miami-Dade County?
Nationally.
Wow.
Nationally, 1 in 4 people, right? So right now in this studio we're in, there's 4
There's
people.
only 4 of us.
So,
I'm looking at you, Zoni.
I have depression. I have clinical depression. I've been treated for that for like 3 decades. And I openly disclose that now. I would not have done that 4 years ago. Before I had this job, I was like, you don't tell people that. But I do now, right? So when you start that way, most people, right, if they don't have a mental health condition, then someone they care about does.
Yeah.
And they actually have experienced the impact of this. And so once you open up that door to say, this is a safe thing to discuss with me, you don't have to tell me anything, but you just know in your head, okay, this is a different a way of looking at things. This makes it seem like whatever went on with my brother or my sister or my cousin is okay.
Yeah.
And, people get behind
And it's
that.
part of your reality in terms of
Yeah.
what you're dealing with, and creating space for people to discuss it is also a value, because it is, even if you are dealing with a thing, if you know there's a space to talk about it or address it, it makes it easier to not put it to the side, but move past it. Like when you need to focus on, because I know I can bring this up when I need to.
Right.
But like right now, I don't need to pretend that I'm not stressed about a thing or worried about a thing. And you can say it and then be able to move on, because the opposite happens many times when you're worried about a thing and you don't want others to know or bring it up at work. That in itself is your version of holding on to this thing that it's just an additional weight that you're carrying that doesn't necessarily help you in the
Right.
long run, because
Right.
it's like running a marathon race with an extra 40 pounds. And if you're going to be able to put down some of that weight, it helps you in the long run. And I think that many times we don't realize just being able to communicate about it and just say the thing has its value in the space and allows us to move on. That was really interesting. I did not know that number, 1 in 4. When did you start? Well, 2 questions. One, when did it start? When did you start seeing this data and this gap of not just mental health resources and tools, but how big the number was in terms of people dealing with this issue here locally? Is my first question.
Well, this data comes from Mental Health America, which is a national organization, and the number actually up in the 5 years that I've been involved in this, it was 1 in 5, and this year it moved to 1 in 4. So whether or not more people are living with mental health conditions, or more people are willing to disclose that they live with a mental health condition, because that could be where we see the number changing, is that they're now
That's
more
true.
willing to disclose it.
Yeah.
You
There could
know,
have been more people there before, and they just didn't.
weren't going to talk about it.
Yeah.
And that's a lot of the work we do, is for people to, feel more comfortable disclosing, I have a mental health condition, and it might affect the way I work or how I work. I think, for entrepreneurs who when having more flexibility, because a lot of people start their own businesses because I needed flexibility. That's one reason I did it.
Yeah.
And so they may be someone who, knows, look, I'm not cut out to work a 9 to 5 in that kind of an atmosphere.
Right.
Emotionally, that doesn't work for me.
Yeah.
So there are plenty of people that's a reason that they start their own business. So we have there's a lot of data about how it affects the workplace. Depression is the number 1 cause for people taking disability leave worldwide. So, people don't know that, but that happens. And so looking at mental health conditions the same way that you would look at a physical condition, like I had rotator cuff surgery, so I had to take some time off.
Yeah.
If I feel that, I can't work anymore right now, my head is not in the right place, I'm going to take some medical leave here. That's a perfectly appropriate thing to do.
Yeah, and probably more helpful in the long run too, because many times before, like even my parents, many times is this more the generation of just like grind and work through it,
power through it,
and that was just the way.
Right.
And also being from the Caribbean, whereas like you don't complain about illnesses, you go drink some type of tea or put some honey on it, and then you keep doing what you got to do. But that doesn't always help, or especially in the longer term. It might not, short term or long term, many times it really doesn't have much more of an impact than we often realize.
Right. And I think so I guess we're in the statistics section of the show, because I'll give you one more. The average time that it takes a person between the time that they think they might have some kind of a mental health
Like when they first become
problem,
aware of it?
to the time they actually accept it and are getting full treatment. And it would be the person or their loved ones around them. The average time that takes is 11 years.
11 years.
11 years.
Where a person starts seeing a pattern or something that
Right.
might be an issue, to 11 years where they decide to actually do something about it.
Right, or
That's
they
large.
decide enough to, sometimes
Like it's a problem enough, like, hey, we need to do something.
I got to get treatment. This is a real thing, right? Because you talked about that, well, I'll just, I'll power through it. It'll
Yeah.
pass. It'll go away. And it takes, so it's a long time. My hope is to shorten that time.
No, 100%.
Is that if you feel this and then you get the help you need, and then you get into recovery, if we could shorten that time.
Yeah.
But people, they don't want to accept it. They don't want to believe it.
Or even when they notice, like I mentioned, like my family is Haitian, and like the culture is like you just work. And like for full disclosure, my father had Parkinson's.
Oof.
And like, it was probably like 20 years where you saw a couple tremors or other things like that. And it wasn't until like later, when he was much older, where it was a problem, and he was also closer to retiring, where you try to go figure out what to do. But then 20 years before then, you just walk it off or put some dirt on it, and that's
Right.
that's what you
Right.
do. Many times because you may or may not have a choice, or you feel you don't have a choice. But also, one of the things that's interesting, it's a lot easier to find resources now, and that's also I was
True.
curious for you and the work that you do. How big is the gap, or when did you start noticing the gap in terms of resources available for individuals, like here in Miami-Dade County, between the need and what was available?
Well, that was interesting because that was, as I said, I wasn't really trained in this, but in my time in the mayor's office, I really had to look at that. What is happening in this county? What resources do we have? What resources do we need? And so there were a couple of areas that we were able to do some research, and that we were able to make some change. So one of the issues in mental health care is that there are, most people have mental health coverage if they have health insurance, they have mental health coverage, and they don't know that.
Oh, they don't even know it's an option.
They don't even know it's an option. They don't look at it. They don't consider it. So most people think, I can't get counseling. I can't afford it. It's expensive. I can't do that. Most people are covered even if you're on a marketplace plan, because with entrepreneurs, often that's the plan. It's covered, and it's confidential, because people they think if they go to their insurance, and if you are on an employer plan, they have employee assistance programs. So even at NAMI, there's 15 employees, so we're basically a small business, but we have an employee healthcare plan. We have an employee assistance plan, which you can call them and say, I think I might be having a problem.
Yeah.
And they will help you, and they'll talk to you completely confidential. I have no idea if any of my employees ever did this, and people think it's not confidential, but it is. And so those resources are available. There are also plenty of free resources for mental health care in the county. There's free resources for children. There's free resources for adults. You can call our helpline at 305-665-2540.
So that NAMI helpline is available for everybody? Or
For everybody.
A certain age?
And no, we'll help anybody.
Okay.
And those are the kinds of questions we answer. Where can I get free or low-cost mental health care? Or I'm insured, but I don't know how to find this mental health care. So those are we answer any questions having to do with mental health. But it's there. We do have a shortage of providers, so often the wait to see someone is long. So that's a frustration. The other thing is people who provide mental health care, especially therapists, those are all small business owners. You know, they're running their own practices.
Running their own practices.
Yeah, and there's not a lot of support for them, for if they start to feel burnt out. You know, when you're listening to other people's trauma all the time. So there is that's one of the things
you're the one taking on that weight collectively for a lot of people, and so therapists for the therapists.
Exactly, and there's not a lot there, even from their own associations. So we've been looking at that. And trying to figure out if we can start a support group for mental health care providers. Because we at NAMI have support groups for people who live with mental health conditions where in a group they can talk to other people and feel completely normalized. We also have support groups for family members of people with mental health conditions. So they can talk about whatever's gone on in their family in a completely normalized setting. But these healthcare providers, these mental health care providers don't have that. And so I would love to see that happen at some point, and we're working on that. But so there's a need there. And then there's some other things. One of the things that we've helped lobby for and that we have now is mobile response teams. So mental health care mobile response teams. So if someone in your place of business or in your home is having a mental health crisis where they're, as long as they're not behaving in a way that's dangerous to themselves or someone else, but say it's a family member who hasn't left their bedroom in a week, and so they seem to be there's something not right there, or you have an employee who is behaving in an unusual way at work, a way that you have never seen before, you can call this mobile response team and they will come to you.
They'll come on site.
They'll come on site. It's the number is 1-800-HELP-YOU.
1-800-HELP-YOU.
Yes.
YOU.
YOU.
Interesting.
And they'll come to we've had them come to our office.
They just made them available for anybody who needed it for X amount of time on site.
Yeah, they'll come. No, for us, people come into our office
people come into
and they
office.
need help. Yeah. And if it's a situation that we don't, because we're not therapists, we're not counselors.
Right, got you. Okay.
If it's a situation we feel like we can't handle, we'll call them.
Yeah.
And they'll come and talk to that person. And we get a lot of people that call the helpline. And like that scenario of my son is in his bedroom and he hasn't come out for a week.
Yeah.
He hasn't eaten. He's not drinking. He's talking to us, but so we will do a warm handoff to that mobile response team and
get them the help immediately. I didn't know it was available.
Yeah, that's a fairly new development. I think it's been 2 years that the Thriving Mind, which is the organization that manages the state funding for mental health care in our county.
Thriving Minds.
Thriving Minds, yeah.
That's interesting. I'll have to look them up. Just a quick pause. I was just going to reintroduce you.
Okay.
For those listening to Strive Through 5 Small Business Podcast on Slam, Sirius XM Radio, because we're hosted there. I'm your host, Irvans Agustin, and today we're talking with Susan O'Mahony. O'Mahony? O'Mahony.
That's how they pronounce it.
I'll get it right on the third time. O'Mahony. O'Mahony Holtzman, President and CEO of NAMI Miami-Dade County. We've been talking about mental health, leadership pressure, caregiving, community system, and resources, and emotional realities that often sit underneath the entrepreneurship and daily life here in Miami. And it's interesting just listening to some of the information you're sharing and also just realizing you've only been in this role for like 5 years. You started at the tail end of like the pandemic.
Oh.
Also though, right?
Oh yeah.
And so like now stepping into that feels like the pandemic was at a particular heightened moment.
Yes.
And how do you feel like that has shifted from since then to now?
Well, definitely with the pandemic, people were more willing to acknowledge right? Mental health challenges, because everyone was feeling it, right?
Yeah.
Everyone was
Everyone was in
feeling
the same boat.
isolated and stressed, and they wanted to talk about it, and that was just a great thing for mental health advocacy. And it was like, we were like, this is our moment, we got to grab this, and because we didn't know how long it was going to last, and there was a lot of funding
that was put into
coming towards it, and that has started to lag a little bit. It has, but I think that because we did some surveys, I was in the mayor's office during the pandemic, and we did some surveys, and there were a lot more people just showing up at mental health emergency rooms.
Physically just show up. Oh, mental health emergency rooms.
Well, so you can go to there's some government funded mental health organizations. CHI is one of them. I think New Horizons.
I hadn't thought about that, but yeah, there definitely are places you can do as a walk-in.
Yeah, you can walk in, and interestingly, the people that were walking in, right, was I think, if I remember this right, and it's not my best thing, but numbers and data, but the 30 to 40-year-old range, women more than men. So women at home with their children. Women, they were the ones that saying, I can't do this, I need help. And
they're also the ones probably better than men many times who are more emotionally aware.
Yes.
And to say, like, this is my breaking point, or this is an issue, and push to get help. So yeah,
men are less likely, without question. Men are less likely to ask for help. They're also more likely to succeed in suicide. Women attempt more often, but men succeed more
successful
often.
at it.
Right, but
Can't just rub dirt on everything. You need to go talk to people.
Right. Well, men tend to use more lethal means.
Yeah. Especially in this country where we have access to other tools that help you do that.
Yeah.
Interesting. I was going to shift gears real quick.
Okay.
I'm going to ask you a couple quick questions, and the first couple things that come off your head.
Okay.
What are some things you feel that Miami-Dade County has done right around mental health?
Well, certainly the mobile response units. The Sheriff's Department has a co-responder model, which is when you call 911, if you make sure you let them know that this is a mental health emergency, they will send, if they have available, and right now I think there's 2 units, they will send a police officer with a mental health professional in an unmarked car, dressed in different uniforms, so that they're not threatening.
Yeah.
And these people are specially trained to de-escalate any situation where there's a mental health component to it. So,
I didn't know that.
Yeah, no, that I worked on that in the mayor's office. You can get that through 911.
And you just ask for that specifically in terms of mental health.
Say this is a mental health situation. The other thing you can do is ask for, so that's the Miami-Dade County Sheriff's Office has that. As we know, there's multiple police departments. And so if you ask for a CIT trained officer.
CIT trained officer.
Right. That's crisis intervention trained. Ask for a CIT trained officer, and most of the police forces like City of Miami and City of Miami Beach have CIT trained officers. So specifically ask for that, and those people are trained in de-escalation. So that's an important thing. So that's happening.
It's huge. I didn't know that was offered. But and the thing is, like, it's a specific term, and you have to know to ask for that.
Right.
Yeah.
Right. Or say it's a mental health issue.
Yeah.
You don't have to say CIT, but if you know it, they recognize that because you're speaking their language.
Yeah.
But be very specific. Say, and so that's happened. That's great. Mayor Levine Cava signed on to the stigma-free workplace program that we have, which is we come in and give trainings about mental health and mental illness in the workplace. What the prevalence is, some of the things that we've talked about.
Yeah.
How do you address it in the workplace? How do you talk about it? What's the right thing to do? And she signed the county on for that. So we are providing
part of
that
that,
program to, which is, it's a lot of people. We thought we were going to get one small business, and we got Miami-Dade County because she is such a champion.
Yeah, especially in the work she was doing before with cannabis
Right.
and other things. Like she realized the importance of it.
And we have the Behavioral Health Advisory Board now that was put together by Senator Rene Garcia, County Commissioner, and I'm part of that board. We're about to launch a mental health awareness social media campaign. You can keep your eyes open for that. It's going to launch any minute, I think. And so the county government is really looking at ways to help reduce stigma and give people the information, the right number to call. The 988 line, which is a national number. Are you familiar with that?
I was not.
Okay, this is important.
988.
988 is the mental health crisis line. So that is if you
That's a national number.
That's national. That was passed by Congress, and that was activated, I think, 3 years ago now. And so if you or someone you care about is contemplating suicide or having a mental health crisis, call 988, and they will talk to you. These are trained clinicians that answer the phone. They're trained in crisis management, and they'll talk to you and refer you to the services that you may need or help de-escalate a situation. There has been a dramatic drop in youth suicide in the past 3 years since this was, the data came out just, a week and a half ago, so I don't know it by heart yet, but a dramatic drop in youth
Oh, that's
suicide.
great to hear.
Yeah.
And that's open to anybody.
To anybody. And that's 24/7, no matter where, anywhere in the country. And it's geolocated, so if you have, say you're visiting Miami from Colorado and you call it, you'll get Miami
you get
resources.
resources.
Yeah,
Gotcha.
yeah.
That's fascinating. I didn't know that. What is one thing that business owners and leaders need to hear more often?
One thing? Can I have two?
You can have two. I'll give you two.
One, I think as a business owner and an employer, it is important to understand that if you want to get the most out of your employees, that you have to consider their mental health along with their physical health. So making sure that there's a work atmosphere that is supportive of mental health, which, means having enough break time, having enough access to natural light is a very important thing. I don't know if people realize that.
Very underrated.
Yeah, seasonal affective disorder. I had an employee that had that, and our first offices had no windows at all. And so she would hang up pictures of, she was from Jamaica, she would hang up pictures of the beach in Jamaica.
And
but
that helps.
It helps a little bit, and you can get a special kind of lamp. But understanding that
when they say go outside and touch some grass, like it does.
It's a real thing, yeah. And so if you want the most out of your employees, you accommodate their needs, whether it's having an up-to-date computer to do the work on, or having a work situation that isn't going to have a negative impact on their emotional health. So there's that. And then the other thing is, if you, as an employer, because that is 24/7 when you run your own business. I used to talk about it as, and it's how I feel now. You're always running around that wagon because there's always one wheel off, right?
Yeah.
You got this one on, and then you got to run around the other side because that one fell off. And take care of yourself.
No, most definitely. And I think that's the most underrated thing, especially when you feel like everything depends on you.
Right.
Many times it does. If you're a solopreneur or a small business owner, everything does stop with you. But if you're not in the right place, if you're not healthy, if you're physically not able to do what you do, you can't help anybody.
Right.
And so, definitely put your air mask on first.
Yeah, develop a peer support group. I think that's a lot of, with Strive 305, you do have this sort of peer support group.
Yeah.
And that's really important, to have some kind of peer or social support. And when that doesn't work for you anymore, if that's not working, don't wait 11 years.
Definitely don't.
Get the help
and
you
it
need.
doesn't have to look a particular way, because I think many times people think it has to be or look a certain.
Right.
The help can come in many different forms and shapes, and just still help.
Right.
And I definitely feel that's underrated. And last quick question: what gives you hope right now?
What gives me hope? Well, the fact that we're having this conversation right now, that people want to hear what we're offering at NAMI and what we have to say, it really does. It really does give me hope. And when we talk to a family who have been able to openly share about what they've gone through, the relief that you see, that's an amazing feeling. And so, yeah, I have a lot of hope. It's people. People give me hope, because it doesn't matter what else is happening around us, as long as we're kind and loving and open to each other.
100%.
Right.
Now I can see why you got the Changemaker Award. Congratulations! Congratulations on that.
Thank you.
She's not wearing that jersey just for fun. Custom jersey. See that, Holtzman?
Right, Holtzman.
So now that you have the Changemaker Award, what's next for you?
What's next for me? Well, we
You
have
did mention your walk.
the walk, right?
Coming up.
So
where do people find out about that?
At NAMI Miami.org, NAMI Miami.org, and the walk is coming up on this Saturday, May 16th, at Lone Depot, home of the Marlins Stadium, and it's we do this every year. And a couple of things. They do these across the country, right? There's over 650 NAMI affiliates.
Oh,
I would say,
wow. I didn't realize that many.
Yeah, all over the country. I would say like ours, but not like ours, because we are one of the larger ones, and we have had the biggest walk in the history of NAMI here in Miami. And so we want to keep that going.
You want to keep that going?
We want to keep. Last year we had 3,000 people at the stadium.
So we just go to NAMI.org.
NAMIMiami.org. And there will be a pop-up link, and you can just click on that and register it's a 5K walk. You're welcome to run it, but it's not a race because we're very family friendly. But we're outside the stadium. Jawan Strader is our MC from Channel 6. We have Mayor Levine Cava is going to be there getting an award. Mayor Eileen Higgins is going to be there. She's a huge supporter.
She is.
And we've multiple county commissioners. We've got some sports figures coming. Still nailing that down, because they're those guys. Hard to nail them down, but they're coming. We'll have batting cages and face painting, and the Mays High School Music Conservatory marching band. From I think they're in Goulds or Prine. They're going to be leading us, and it is really fun.
Sounds like a fun event.
People are out there celebrating mental health, and all the people that provide mental health care are there. So if you're like mental health curious, but you're shy about it, come on out.
Yeah.
Everyone's
or come for somebody
there.
else. It doesn't have to be for you. You can come and support somebody else.
Yeah. It's a good time. So we hope everyone will come. We want to make sure we want to beat that 3,000 that we had last year.
It sounds like
it doesn't cost money to register. You can donate, but you don't have to.
That's amazing. Susan, I'm glad you're able to make it and we were able to figure it out. You're a gem. Thank you for the work you do and for really just making the time to come out here and talk about this important subject. And thank you for everybody listening to Strive to Thrive Small Business Podcast. These are the kind of conversations we're really looking to continue having, and not just about business growth, but just really what healthy, resilient communities look like. And I think this is a key part of it. If you enjoy this episode, make sure to subscribe, share it, and stay connected with us for the future. And we want to hear and engage more amazing people like yourself in the future. So thanks again.
Thank you for having me. It's really been a pleasure.
No, the pleasure has sincerely been mine. For my thank yous, shout out to Miami-Dade County and Mayor Daniel Levine Cava is one that started the Strive to Thrive program. The Beacon Council, my Beacon Council Foundation, technically, they're the ones who are now housing the Strive to Thrive program. Wells Fargo, gotta thank the money people, and Miami Community newspapers who are offering us this lovely space. And
yes.
Mike Miller and Grant Miller, they're incredible resources in this community as well.
They are.
Slam Sears XM Radio for rebroadcasting us. And my favorite producer, Zoni. Thanks for hanging around and making this happen.
Thank you, Zoni.
My name is Irvans Agustin, and thank you for listening. And we'll see you next time. Stay caffeinated, stay curious.
Thank you.
You want to launch a podcast, but you got no clue how or where? C News TV makes it easy. Choose from one of our 4 podcast studios, Studio A, B, C, or D. We provide the professional space, the equipment, the crew, the know-how, and even a host if you need one. Book a studio now at sales@cnews.net.